All right, everyone. Welcome to the webinar. It's all connected, the chiropractic edition. We've got quite a bit to go over today, so let's dive right in. My primary goal for the day is to clarify what chiropractic is for you and how it can impact your health, and why it's an important piece in your healthcare. All right. So first off, a couple fun facts. Did you know that spinal manipulative therapy or chiropractic adjustments has a very long history? Around 400 BC, Hippocrates, the father of the Greek god medicine, used manual treatments to treat spinal conditions. So that was a long time ago. So this is not new science by any means, but it has evolved over the years. So that's kind of a fun fact. Do you need a chiropractor? So this is a really fun question. I like to compare it to a dentist. So do you need a dentist? You would say, well, I eat food, so yeah, you should probably go get your teeth checked. It's the same thing with your spine and spinal health care. It's even more important to get your spine checked because your spine protects your spinal cord. Your spinal cord is your lifeline, right? That is what connects your brain to your body. It's the only reason you are living and the only reason things happen in your body. So without the brain and body connection through the spinal cord, your lungs wouldn't breathe without you thinking, your heart wouldn't beat without you thinking. So it's very important that you have spinal health. So I would say, yes, you need a chiropractor. Get your spine evaluated. If you're moving, if you're living, it's probably a good idea. All right, preventative care. This is my favorite way to take care of my patients. So I have a lot of patients that come in the office that do have spinal complaints, whether it's pain or discomfort, headaches, whatever it may be. However, the best time to take care of spinal health is going to be before you have symptoms, all right? So as preventative care. So first off, what do chiropractors look for? We look for subluxations. That's going to be an area in the spine that's out of place and stuck enough to cause nerve damage. This nerve damage does not always present with an outward symptom that you might notice right away. So it doesn't always mean that you're going to have back pain or neck pain or a headache, but it does mean that there is interference between the brain and the body that can present in a number of different ways, which we'll get into later into this presentation. So I do encourage every single one of you to at least get your spines checked and be preventative so you never end up in a space where you have problems and pain and discomfort. Why chiropractic care works? Well, if you have a subluxation in the spine, so an area out of place and stuck enough to cause that nerve damage, we are trained to find that. When we find that, we remove it. When we remove that interference, we then enhance or reconnect that brain to body, meaning we take away that negative interference. We take away the problem and we let your body do the healing. Your body is brilliant. If you cut yourself, it heals. Obviously, if the cut is big enough, you might need stitches. It might need a little bit of help. So if the subluxation in your spine is bad enough or it's been there for a long enough time, then you might need help. You might need a chiropractor to help to set that back to where it's supposed to be, to remove that interference so that brain and body can connect. What to expect when coming into our office. So during your initial visit, what we're going to do is we're going to sit down and talk. We're going to have a consultation. We're going to take a full history. We're going to talk chemical health, physical health, emotional health, any surgeries you may have had, medications you might be taking. We're going to do a full history because it is important to understand who you are as a person. We're all individuals. Even if I have two patients coming in complaining of low back pain, that doesn't mean they're the same, right? That just means that they both have similar symptoms, but they could be coming from different problems. So we do a full consultation. After that, what we're going to do is an examination. So we'll do a full neurological examination. We're also going to look for those spinal subluxations. We do x-rays when necessary to make sure that there is nothing that we should not be addressing or adjusting in certain ways. So we want to rule out severe pathology such as fractures and things like that. Obviously, we wouldn't want to go in and adjust those areas. So we always test. We always look for the structure of the spine as well. We need to make sure that the structure is the way it's supposed to be. So normal structure, that helps with normal function. If it is not, then we need to talk about correction. After we do x-rays and imaging, then we do scans. So they are nervous system scans. You're going to get a heat and an inflammation scan. You're going to get a muscle tone and balance scan, and you're going to get a heart rate variability. So that's basically a stress test. What this does is give us a deeper look into the nervous system and a deeper look into how your body's functioning. Because remember, while you may be coming to your chiropractor with symptoms and problems such as back pain or neck pain, our primary goal is to check the health of the spine. What we do is fix that, right? So we get in, we find the subluxation, and we correct it. That is the sole purpose of what we do. A side effect of that is going to be relief from the back pain or the symptoms that you're coming in with. After we do all of those tests, we generally do relief therapy in the area. So electrical stimulation therapy, traction therapy, ultrasound therapy, all of these therapies are geared towards helping calm the muscles down to make you feel a little bit better on your first visit. However, we do not adjust on the first visit until we absolutely know what is going on under the surface. We need at least 24 hours to review all exam findings and x-rays. What will happen after that is you will come back for a report of findings. We will show you exactly what we found. We're going to show you your scans. We'll show you your x-rays. So not only do you understand what we found, but you have a better idea of what your overall spinal health looks like. From that point, we'll discuss a treatment plan, and then we'll begin care at that point. Posture. So one of the things that people ask a lot are, where do subluxations come from? Why do I have them? Well, they come from physical stress, chemical stress, and emotional stress. It's different for everyone. They typically have something in each category, though. So what this slide is asking is, how is your posture? In this day and age, sitting jobs are very common, right? So a lot of people sit at a desk all day, and if you're really focused and into what you're doing in your work, then you're probably not paying attention to your posture. So in this particular picture, he's got great posture. No, he doesn't. So he's rounded forward, and you can see his head is all the way forward, so his eyes are kind of looking at the screen. This is very common, more common than you would think if you would walk through an office space. So how is your posture? It looks stressful, doesn't it? It doesn't even look comfortable. So sitting like this for long periods of time can cause subluxations under the surface. Those subluxations will interfere with brain-body connection. That can cause symptoms such as neck pain, back pain, headaches, things like that. Atlas adjustment. So what this is talking about is the very, 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 very top bone in your neck. The very top bone in your neck is super important for a few different reasons. Well, all of the bones are important, but your brainstem sits right at the base of your skull. The atlas in particular is part of your rest and digest nervous system. So you have two parts to your automatic nervous system. You have your rest and digest, and then you have your fight or flight. We are designed to be in a fight or flight space about 20% of the time, a rest and digest space about 80% of the time. Unfortunately, with how stressed the culture is today and our community is today, that doesn't always happen. So we do test for that. That's that heart rate variability test that we do on the first day, or that stress test. But the atlas in particular, if you have a subluxation at the atlas level, so in that upper neck, what that does is it blocks that parasympathetic, or that rest and digest nervous system, from working the way that it should. So if you're blocking it, what does that mean? That means that you cannot get into a rest and digest state. So exactly what that's saying, okay? If you can't get into a rest and digest state, you can't rest, you might have trouble sleeping. Digesting food is going to be very difficult. In particular, things like blood pressure too. So there are research studies out there too with the atlas adjustment specifically. If that is subluxated and it is adjusted, it has shown to lower blood pressure. So it's a super powerful adjustment in the fact that it has a huge effect on the nervous system, but every single adjustment that is done by your chiropractor will have that effect. We are trained to find the subluxations, and we are trained to remove them so that you don't have that interference anymore. So atlas adjustment, if you ever hear that, it's a super powerful adjustment. It's very specific to that rest and digest nervous system. Chronic sinusitis. So this is something that is super common right now because of the weather. So currently just had a snowstorm this weekend, but it's really common. It's super uncomfortable for people though, right? So if you have, stuffy sinuses, all of that pressure can cause headaches, it causes infections, all sorts of not fun stuff. Chiropractic can help with this because by removing subluxations, you allow the body to function properly. Proper function of the body is to drain sinuses, okay? So when those sinuses are congested, your body should be healthy enough to drain those. So by getting adjusted, you can help that. Also, getting adjusted boosts the immune system 200 to 400%. So if we're boosting that immune system, we're boosting your body's ability to fight any viruses or bacteria that may have entered your body that could be causing this chronic sinusitis. So through spinal adjustments and even sinus adjustments, we are able to help with this. Hearing loss, tinnitus, and vertigo. So these also typically are highly linked to that atlas that I was mentioning earlier. So the atlas adjustment at the very top of the neck can help with hearing loss, tinnitus, and vertigo. So a lot of these symptoms happen because there are subluxations in that area. So super powerful adjustment there. The ears in particular hold your balance center. So if you've got fluid in your ears because of a virus or bacteria, or just because they're not draining properly, then you can get vertigo. So by adjusting the sinuses, adjusting the spine, and even adjusting the ears, we're able to help with this. Premenstrual discomfort. So this is really common in women. And basically just talking about discomfort, right? Cramping, bloating, not feeling good, fatigue. It can come, but it can also be helped by chiropractic care. So a lot of these symptoms come from being in a high fight or flight or stress state. So if we activate that rest and digest nervous system through adjustments, then we can help with these symptoms. So it can be super helpful with that as well. Back pain is also another common symptom of that, which adjustments help too. Pregnancy. So at Yost Family Chiropractic, we do specialize in prenatal care and pregnancy care. And it's really important for a number of different reasons. A lot of women who have pre-existing conditions in the spine don't know it unless they have symptoms, and they get pregnant and then they grow bellies and build babies, and all of a sudden they're starting to have all these symptoms, low back pain, discomfort. That is the last thing a woman wants when she's pregnant, is not to feel good physically. So that is something that we specialize in specifically just to help keep you comfortable and functioning the way that you should. Also, your pelvis, which the baby comes out of or through, so it comes through that pelvis opening. If your pelvis is subluxated, so if it's twisted or stuck, then it may not open the way that it should or be as flexible as it should when you go to deliver. So getting chiropractic care before delivering is really important, but it can also help reduce labor and delivery times, which is awesome. And that's what every woman wants to hear. They don't want to be in labor forever. So just by removing that subluxation physically can help speed that process along, but also neurologically, right? So in order for your uterus to contract, in order for you to dilate, in order for you to go into labor, your brain and your body have to connect. Your brain has to send those signals to the uterus. Well, what happens if you have a subluxation right in the area where the nerves to the uterus come out? It might cause some problems, right? It may not. You know there's interference there. So by clearing that out, you can be sure that your body's functioning at optimum level for labor and delivery. So it's so great to have chiropractic care while you're pregnant for a number of different reasons, for mom, for baby, labor and delivery. But we do specialize in it. They highly encourage you to come and get your spine checked if you are pregnant, or even better, if you're thinking about getting pregnant, come and get your spine checked before, so you can clear out some of the stress and subluxations in your spine before you go out on that journey. Attention deficit and hyperactivity disorder. So this is commonly diagnosed today. ADHD, it is a brain-based, neurological-based condition and diagnosis. So if we as chiropractors are addressing the nervous system and we're taking stress off of the nervous system, it makes sense that we can help with this. Anxiety, depression, and stress. These are also very common symptoms in today's culture and today's world, but they are strongly connected to the nervous system, right? It's strongly connected to the brain and the spinal cord. So by adjusting the spine, we're able to remove that interference. So it helps with these things as well. So if you are seeing your chiropractor for back pain, or you haven't even seen your chiropractor yet, or you haven't found one and you have neck pain, headaches, back pain, some of the typical things that you go into a chiropractor for, make sure you mention things like anxiety, depression, and stress, because there are ways and techniques to help reduce this even more when doing the spinal adjustments and the assessment. So Super important to bring that up as well. Asthma. This is also pretty common. So the nerves in the mid-back go to the lungs. So more often than not, the people and kids that I have come in with asthma have a lot of subluxations in that middle area of their back. It becomes very, very tight. So it's super hard for the brain and the body to connect in those areas. So by adjusting the mid-spine and also that rest and digest nervous system, adjusting in those areas when subluxations are present, can help reduce the symptoms of asthma. I've even had kids that are no longer using inhalers now that they've been under chiropractic care, which is super awesome. So, digestion. So, rest and digest, digest. Some of the things, like I mentioned before, that cause subluxations are physical, chemical, emotional stress. So chemical stress also includes the foods that you are putting into your body. So you want to put good foods in your body, right? Nice whole foods, fruits, vegetables, organic. You want to stay away from the processed stuff with a bunch of chemicals. Your body doesn't like chemicals, okay? So it can cause inflammation and a number of different issues that can also cause subluxations. However, if you are not getting adjusted and you have subluxations in the spine, do you think you're going to be able to digest your food properly? Probably not, right? So even if you are eating all those organic fruits, organic vegetables, all this really good healthy food, if your body is not able to digest it properly, you're not going to be able to get the nutrients you need from them. So get your spine checked, make sure that you do not have subluxations interfering with that process. It is very, very common in the high stress society and world today that we see the body unable to get into that rest and digest state, which leads to things like indigestion, but also anxiety, brain fog, heart palpitations, a whole number of things. And it just, I mean, the list of symptoms can go on forever, but making sure that you get checked can really improve digestion of the foods, which is good. Managing diabetes. So again, kind of the same base here as far as how chiropractic can help with this. So blood sugar handling happens in the body through the nervous system and a number of cells, so organs and glands that handle that. If the nerves to these organs and glands that are supposed to be monitoring and regulating blood sugar have been interfered with or are not working properly due to subluxation, it can worsen the condition. So by getting checked and removing those subluxations can also help with diabetes. What others are saying, if you guys are curious about our office in particular, please jump onto our Facebook page, jump onto Google, search for Yost Family Chiropractic. We've got a ton of great reviews on there, but what's even better about them is they are coming straight from the patient. So they're coming straight from people who've had these symptoms, who you can connect and relate with. So you know what the experience is like from beginning to end, and relief care going often to relieve pain or even just wellness care, preventative care, because I can tell you all day long how wonderful it is for you, but I know how important it is for you to see what other people are saying and how other people are responding. And we have a great community, so I would please urge you to get on and check out our Google reviews, our Facebook reviews, and get a hold of us. If you've got questions, get a hold of us. You can email us at any time. The phone number will be at the end of this presentation. So calling us, you can set up a free consultation, and that's a great way to get information as well. So, causes of misalignment. We did already go over this. So causes of misalignment are going to be physical stress, chemical stress, emotional stress. So physical stress, a couple of those, just sitting at a desk all day. Physical stress being, I'm a UFC fighter, I'm a football player. Physical stress being kids and gymnastics, falling down, car accidents, any type of literal physical stress on the body can cause subluxation. Chemical stress, like I said, putting preservatives inside of your body, processed foods, things like that are chemically stressful for your body. Drugs, alcohol, medications, all of that stuff have to be filtered through your body through the liver. And in this society, we're overwhelmed with that stuff. So that's another thing that can cause it. Also, emotional stress. So not knowing how to handle emotional stress, or times where you're feeling overwhelmed, or times where you're feeling really depressed or sad or stressed out, super busy, like you can't keep up, there are healthy ways of managing things like those feelings. And without having, the tools to do that, if you let that stuff build up, that causes subluxation. So there's so many things. That's why when at the very beginning it says, do you need a chiropractor? Well, yeah. I mean, I would love to meet someone who doesn't have any physical, chemical, or emotional stressors, but it's just not the case. Just like for a dentist, you're eating food every single day. You do the best that you can at home to maintain, clean teeth, brushing, flossing, things like that. And then you go and you get your teeth checked and you make sure that there are no cavities, because you don't always feel them, right? If you have a cavity, you don't always feel it. And by the time you feel it, it's probably pretty bad. And root canals are not fun. I've been there, done that. You don't want that. It's the same thing with chiropractic. You're not always going to know a subluxation is there. So it is good to get your spine checked. By the time you know it's there, it's probably pretty bad. Those are the symptoms and signs. That means it's going to take longer to back up out of that, which isn't fun, because no one likes to be in pain or dealing with symptoms for a long period of time. Bridging the gap. So every single healthcare community out there has its place, and they're all trying to help people get healthy, right? They're all trying to help you feel better, to do better. If you're sick and you go to the medical doctor, they're going to do what they can for you. Same with the dentist, they're going to take care of your teeth. Chiropractors, we take care of the spine and the nervous system. It is important that we communicate and connect with all your healthcare providers, because that is how you're going to get the best care. So at Yost Family Chiropractic, we strive for that. We have really strong connections with the doctors, the medical doctors who refer to us, the physical therapists who refer to us, and then we refer out to them as well, because we have our own special purpose in your healthcare, and so do they. So it's really important to bridge that gap and make sure that you cover all the bases. And chiropractic care is a really great way to do that on kind of a holistic, non-invasive way. A new way forward. So knowing that chiropractic care can help with a number of different symptoms is great. Knowing how it does it is more important, because it seems like, oh, well, this chiropractic stuff is like magic. You can get rid of headaches and back pain and asthma and indigestion, and you can help with brain fog and depression. It just seems like everything, right? Well, it's because why? That's not actually what we're treating. We're getting rid of that interference between the brain and the body. That is why it works. That is why so many patients that come in with low back pain end up saying, oh my gosh, I have more energy and I don't have brain fog anymore. What is happening? Well, the body's working better. And that is the primary goal. So it is a new way forward. It is a new way of looking at your body and looking at health in a different way. Instead of, okay, this is a symptom, let's tackle that. Let's get to the core root of it. Let's work on health. So you made it. We went through a lot of information today. Please, please, please reach out if you have questions. Again, my goal is just to establish kind of baseline knowledge and understanding about what chiropractic is, what we do, what your experience will be like in our office, and how you can benefit from it. So as promised, this is our phone number. It is 515-278-9678. Please give our office a call. You can call us right now if you want to and leave a message. We will get back to you bright and early Monday morning, probably a little bit later Monday morning. But we will get back to you. And if you want to schedule that free consultation, even just to dig deeper on how chiropractic can help, schedule the consultation. If you want to reach out via email, you can email us at info@yostfamilychiropractic.com. You can email us with any questions or concerns that you have. Thank you guys so much for taking the time out of your day to join me. It's been fun. I hope that you have learned something, and stay warm.